Hi, I'm Melinda and I'm here with Keely, and we're just going to talk a little bit about Diastasis Recti, which is quite common in a lot of pregnancies, and a lot of women actually unaware that this has even happened, and it's a separation of the abdominal muscles. Now Keely's had a baby 8 weeks ago, so she's going to be my model today. So what we're going to do is Keely's going to lie down on the floor, and this is a way you can check to see if you're safe to do any abdominal exercises. If you do have this abdominal separation, you do not want to be doing any form of sit-up exercise. And even when you're getting in and out of your bed, it's really important that you roll onto your side and push yourself up, rather than lifting your head and shoulders off the bed. Okay, and you definitely don't want to be doing any form of exercise that activates these two muscles here, your rectus abdominal muscles. Okay, now what happens is you've got your rectus abdominal muscles running down either side of the stomach, and your lineal alba, which comes from the sternum right down to the pubic bone, is the connective tissue that keeps these two muscles together. Now when you're pregnant, or if you're having multiple births, often what happens is the stomach area, the uterus, is pressing onto this area, and the lineal alba splits and tears. The two muscles slowly come apart. And you may have like a little pocket around the belly button area. Sometimes your tear can be really high as the sternum, or right down by the pubic bone. So what we're going to do, Keely, is test to see how you're doing, since you had Connor here. Okay, so what Keely's going to do is just bring her head off the floor. She can support her head with her hand. Right, you want to keep the shoulder blades down. And what you do is you take your hand and you gently feel, and you rub deep down, following the lineal alba, so that line that you may have had through your pregnancy, and you're rubbing and you're feeling. If you feel two little ridges either side, you'll know you're okay. Now for Keely, she's got a tiny little tear right at the navel, so right at the belly button. For some ladies, you might find, so Keely's horizontal tear is probably about 2 centimetres, maybe 1.5 centimetres, is very, very tiny. Some women, you'll find you have 2 fingers width, some 3, some 4, and some even more. Okay, that's okay as long as you're aware, and we can work on that. We just need to strengthen the transverse abdominal muscles, okay, to try and help draw and knit the lineal alba back together. So continue feeling down with the fingertips, all right down to the pubic bone. So that's how you test to see if you do have Diastasis Recti, all right, which is a separation of the abdominal muscles. Check us out on our website. There's lots of exercises we can do there to help repair this.